Take a close look at this microscope image. At first glance, it might just look like a bunch of abstract shapes and colors, but what you're actually seeing are the building blocks of human bone. Now take a look at this next image. Notice how the structures are more sparse, disorganized, almost like they're crumbling apart. Believe it or not, if you're over 50, there's a good chance the bones inside your body are starting to look just like this, even if you can't see or feel it happening. You see, there's a silent condition that can gradually erode the density and strength of your bones, leaving tiny pockets of weakness that grow larger over time, and putting you at risk for fractures, chronic pain, and in severe cases, even death. The really scary part? Many folks with deteriorating bone density don't experience any obvious symptoms at first. The damage is happening microscopically, deep within their skeletal structure, until suddenly they bend over to pick something up or take a minor fall, and snap! A bone breaks. It's a scary thought. In fact, you reach peak bone mass by age 30. After that, it's a slow decline, unless you know how to spot the warning signs. And trust me, you don't want to miss them, because ignoring these red flags now could mean a future where a simple fall could shatter your bones, leave you bedridden, and rob you of your independence. What's even more alarming is that you may not even realize your bones are deteriorating until it's too late. Bone density loss, also known as osteopenia or osteoporosis, doesn't often show warning signs. It's a silent condition that quietly erodes your bones, making them weaker without noticeable pain or symptoms. By the time a break or fracture occurs, it's often too late to reverse the damage. But here's the thing. The impact of poor bone health goes far beyond just your bones. It can affect your entire body and quality of life in ways you might not expect. We'll reveal the surprising connection in a bit.
What is osteoporosis? Osteoporosis is a loss of bone density and bone mass. And so the problem with that is you're at risk for a fracture. Now, the purpose of bone is to give you structure, to have a place where ligaments can attach, and it's also a reserve for minerals. So if you need more calcium or phosphorus, bone is that reserve.
According to research from the National Library of Medicine, bone density naturally decreases as we age. In your younger years, your body builds new bones faster than it loses old bones. However, after the age of 30, the process begins to slow down. For many, bone loss begins to outpace bone building, leading to weaker bones. And because this happens so gradually, you might not even realize it until it's too late.
You do lose it when you lose it. We're only able to build bone density, believe it or not, up to our mid-20s. After that, you're kind of slowly losing.
Okay.
Did you know that according to statistics from the International Osteoporosis Foundation, about 1 in 3 women and 1 in 5 men over the age of 50 will suffer a bone-related fracture? These fractures can occur from seemingly harmless activities like bending over or even coughing. It's not just a problem for older adults either. Younger people can also experience bone density loss, especially if they have certain risk factors like a poor diet, a sedentary lifestyle, or medical conditions that impact bone health. What most people don't realize is that fractures from weakened bones are serious. A broken hip, wrist, or spine can lead to a loss of independence, chronic pain, and even long-term disability. In fact, people with osteoporosis-related fractures are often at a much higher risk for developing other serious health problems, such as infections, blood clots, or even death. According to reports, fractures due to weak bones are more common than heart attacks, strokes, and breast cancer combined. Yet it's something that most people don't even consider until it's too late. It's easy to assume that bone loss only affects older adults. But the truth is, bone density can start declining much earlier. While it's alarming to learn how quickly bone density can decline and how it can affect your life, the good news is that you can take action to protect your bones. Early detection and simple lifestyle changes can help prevent the severe consequences of weakened bones. Lifestyle habits may also be unknowingly speeding up bone density decline. Poor nutrition, lack of exercise, smoking, and even certain medications can all contribute to weakening bones. Many people don't think about how these choices impact their bone health until they experience a problem, which is why it's so important to recognize the warning signs early. What simple signs could be a silent pointer to low bone density?
So some signs that might indicate osteoporosis would be fractures. Another indication is loss of height. So over time, osteoporosis can cause the vertebrae in your spine to collapse. This is what leads to the loss of height. So if you hear someone joking around about shrinking, or you think that you are, if you've lost at least an inch of height when you go in for your annual physical, you probably need to bring that to your provider's attention and ask to get a DEXA scan so that you can find out what's going on with your bones. And then the last two symptoms are back pain. And so this could be caused by a fracture or a collapsed vertebrae. And then stooped posture. I don't think that we would typically see this until very advanced osteoporosis, but that's known as kyphosis, where the person, kind of their shoulders are more rounded, their back is rounded, and they can't actually stand up straight.
Frequent fractures are the most obvious signs of weak bones. Bone density loss makes bones less dense and more brittle. The more bone mass you lose, the higher your risk for fractures. If you find yourself breaking bones more easily than usual, it's a sign that your bones are losing density. When bones become fragile, even simple falls or accidents can cause serious injuries, leading to long recovery times and other health complications. Another major sign of weak bones is either a constant or sudden back pain. This could be a symptom of a weakened vertebrae. When the bones in your spine lose density, they become more susceptible to compression fractures. The bones in the spine support your body's weight. When they lose strength, they can collapse under pressure, resulting in painful fractures. Over time, these fractures can lead to permanent changes in posture, causing a hunchback-like appearance known as kyphosis. Loss of height, especially over time, is a subtle but concerning sign of declining bone density. This happens when your spinal vertebrae compress or fracture, causing a reduction in height. As your bones lose density, they may become less able to support the weight of your body, leading to compression in the spine and a decrease in height. Height loss might also result in bad posture, which puts more stress on your bones and joints. A stooped posture or a hunched back is another warning sign that your bones are weakening. Weakened bones, particularly in the spine, can cause the vertebrae to collapse and become misaligned, resulting in a curved, hunched appearance. This posture can limit mobility and cause pain. It may also affect your organs, leading to issues with breathing and digestion. Beyond all of these, a decline in bone density can also affect your jawbone, leading to tooth loss. While there are other factors that can result in poor dental health, declining bone density can cause teeth to loosen. While a weak grip could mean muscle weakness, it can also indicate low bone density. When bones lose density, the muscles around them become weaker too. A reduced grip strength can increase your risk of dropping things or injuring yourself. Since bone loss often happens gradually, you might not notice it until it's significantly advanced. While some signs of bone loss, like fractures and back pain, might seem obvious, there are other, more subtle clues that your bones are in trouble. We'll uncover these surprising red flags in just a moment. If you've experienced any of these, it's a signal that it is time to get your bone health checked. The warning signs of declining bone density are there for all to see, but what causes the loss of bone density?
Right now, this might shock you, but 50% of females will have an osteoporotic fracture before they die, and this is almost completely preventable.
The number one factor contributing to bone density loss is aging. As we age, our body's ability to produce bone tissue slows down, leading to an imbalance between bone loss and bone formation. This is particularly true for women after menopause when hormone levels, especially estrogen, decrease. Lack of calcium and vitamin D can also result in declining bone density. Calcium and vitamin D are crucial for maintaining strong bones. Without enough calcium, bones become brittle. Vitamin D helps the body absorb calcium, so without it, your bones won't be as strong even if you consume enough calcium. Another cause is a sedentary lifestyle. Bones need regular physical activity to stay strong. When you don't exercise or move enough, your bones lose density faster. Weight-bearing exercises like walking, jogging, or lifting weights stimulate bone growth and strength. Lifestyle habits like smoking and excessive alcohol use contribute massively to the loss of bone density. Smoking damages bone tissue, and drinking too much alcohol interferes with the body's ability to absorb calcium. Both habits significantly increase the risk of developing weak bones. Certain medical conditions like osteoporosis, rheumatoid arthritis, or certain digestive disorders can lead to bone density loss. Some medications, especially corticosteroids, can cause bone thinning if used long-term. Believe it or not, genetics also play a huge role in the decline of bone density. If your family has a history of osteoporosis or other bone-related diseases, you might be at higher risk for bone loss. Now that you know the signs of bone loss and its causes, what can you do to prevent or reverse it?
If you're eating a lot of highly processed carbohydrates, if you're eating a lot of grains, if you're eating a lot of sugar, if you're eating a lot of empty carbohydrates, there's nothing in that that's going to build bone density, okay? You have to eat what your bones are made of. Remember what I told you they're made of earlier? Collagen, a collagen protein matrix filled in with minerals. And so that's what you need to be eating to build your bones. You've got to have the building blocks or your body can't build bone.
You are what you eat. A calcium-rich diet could very easily prevent osteoporosis. There's no complicated process. All you have to do is ensure you're getting enough calcium in your diet. Foods like milk, yogurt, leafy greens, and fortified cereals are excellent sources of calcium. If needed, you can also take calcium supplements as recommended by your doctor. Vitamin D is essential for calcium absorption. To get that vitamin D in your body, spend time outdoors in the sun or, if necessary, take supplements. Fatty fish like salmon, egg yolks, and fortified dairy products are good dietary sources of vitamin D.
It turns out that strength training is probably the single best thing you can do. And this was a surprise to me because we did an AMA on this topic a little while ago, and that's when I got, really deep on this with our analysts. My assumption was, running must be the best. Like some sort of impact must be the best thing you can do. It was, I assumed running would be better than swimming and cycling, but it turned out that powerlifting was probably the best thing you could do. And I think once you understand how bones work, it became more clear, which is, powerlifting is really putting more of a shear force from the muscle via the tendon onto the bone. And that's what the bones are really sensing. They're sensing that shear force that's being applied through the bone in a compressive way, depending on the bone, of course. And that's what's basically activating the osteoblasts, which are the cells that are, allowing bone to be built.
Physical activity is one of the best ways to keep your bones strong. Weight-bearing exercises like walking, jogging, and weightlifting stimulate bone formation. Aim for at least 30 minutes of exercise most days of the week.
Another idiotic piece of advice that doctors give their patients, that it's based on observational food frequency questionnaire research, is that you should drink alcohol in moderation. It looks like in some studies that leads to increased bone density. There is not a single research study on the planet Earth that shows a causative relationship between drinking alcohol in moderation and increased bone strength. There is no such study on the planet. There is some observational research that shows a possible association between moderate alcohol consumption and increased bone density. But there's never been a causation shown. Okay, alcohol is poison. Drinking 1 or 2 glasses of red wine with dinner is not going to help your heart. It's also not going to help your bones. You can safely ignore this advice.
Smoking, obviously it's not good for you for a host of reasons, but a lot of people don't think, oh, it's bad for my bones. That chronic systemic inflammation that it leads to definitely has a negative effect on your bone density.
Both smoking and excessive alcohol intake can harm your bones. Quitting smoking and reducing alcohol intake can significantly improve your bone health. Regular visits to your doctor can also help catch any bone health issues early on. If you're over 50 or at high risk for bone loss, Consider getting a bone density test to monitor your bone health. A simple bone mineral density (BMD) test, often called a DEXA scan, is one of the best ways to detect bone density issues early. This test measures the density of your bones and can help identify if you're at risk for osteoporosis or fractures.
Did you know that resistance training can increase your bone density? When you engage in resistance training, such as weightlifting or bodyweight exercises, the force of the movement causes tiny microfractures in your bones. Your body then responds by repairing the fractures and making the bone stronger and denser. Therefore, resistance training is important to maintain healthy bones, especially as we age. Incorporating regular resistance training into your workout routine can help prevent osteoporosis and keep your bones strong for life.
Building muscle mass can help protect bones from fractures. Activities like yoga, Pilates, and strength training are great for improving both bone and muscle health. But if your bone density is dangerously low and exercising could do more harm than good, your doctor may prescribe medication to help prevent further bone loss or to stimulate bone growth. Medications like bisphosphonates and denosumab can help strengthen bones. Looking at all the numerous ways you can prevent or reverse the loss of bone density, what's one step you'd like to take to protect your bones? Feel free to share your thoughts in the comments below. Noticing the early signs of bone density loss can be a scary realization, but the good news is that it's never too late to take action. By focusing on improving your bone health, you can experience significant short-term benefits that not only help with the pain, but also allow you to regain confidence in your daily activities. These benefits are proof that your bones can recover and become stronger, even after you've noticed some troubling symptoms. One of the most immediate benefits of improving bone health is a noticeable decrease in pain and discomfort. Bone loss, especially when it reaches advanced stages like osteoporosis, can cause your bones to become fragile. This can lead to constant aches and pains, particularly in areas like the lower back, hips, or wrists. For some people, even simple movements like bending down to tie their shoes or lifting groceries can be excruciating. When you start taking steps to improve bone health, through better nutrition, weight-bearing exercises, and possibly medications prescribed by your doctor, you may feel less pain in just a few weeks. Another immediate benefit of improving bone health is the boost in confidence you'll feel in your daily activities. When you know your bones are strong, you'll be less fearful of performing tasks that you once avoided. Bone loss can cause a person to feel like they are walking on thin ice, afraid to make sudden moves for fear of breaking something. It can also make people hesitant to participate in social events or activities they once enjoyed. For example, someone might stop going hiking with friends or playing sports because they are afraid of falling and getting injured. But by proactively strengthening your bones, you'll regain the ability to move without constant worry. As your bone health improves, you'll feel empowered to participate in activities you love. Whether it's dancing, gardening, or even walking to the store, stronger bones mean you'll be able to do it all with more comfort and confidence.
Sally, do you wish you'd known about osteoporosis just in general when you were much younger? Would it have changed your life in terms of what exercise and activities you would have done?
No, in reality, I was a very good girl, as it were. I did all the things right. I always watched my my diet. I always ate lots of leafy greens and took my calcium, and I did my vitamin D. I did everything right. I never smoked. All of the things that I thought that were right, I've always worked out because I'm an actor and you have to stay fit. So it's always been a big part of my life. But there does come a point that your genetic predisposition is going to kick in. Now, maybe I staved it off. Maybe I kept from having it earlier than, say, my my grandmother did. But somewhere along the line, I'm going to have to deal with some of the health issues that are going to impinge on me.
A real-life example of how devastating osteoporosis can be is the case of Oscar-winning actress Sally Field. Sally has always been known for her strength. Whether playing tough characters in movies like Norma Ray or making people laugh in Steel Magnolias, she always showed the world what it meant to be strong and resilient. Even in her early TV roles like Gidget and The Flying Nun, Sally's energy and spirit inspired a generation.
I always thought calcium and vitamin D and exercise would keep my bones healthy, but I got osteoporosis anyway.
As Sally approached her 60th birthday, something unexpected shook her confidence. She was diagnosed with osteoporosis. For Sally, the news was tough to hear. Despite her active lifestyle, filled with hiking, biking, and yoga, a bone scan revealed thinning in her hips and spine. Sally had used hormone replacement therapy, HRT, in the past, which helped slow her bone loss. But when she stopped taking it, her bone density dropped sharply. This, coupled with the fact that her doctors found she didn't have enough vitamin D in her system, made things worse. Sally decided to fight back, refusing to let the diagnosis control her life. Sally's case is an example of how insidious and cunningly osteoporosis can catch up with people with little to no signs. This means that it is very important to take serious precautions to avoid increasing your risks of having it or even exacerbating it. With these precautions, you can reverse the early signs of bone loss and reclaim a life full of energy, mobility, and confidence. If you've come this far, you now know how vital and important it is to improve your bone health. Think about bone health like you're building a house. The stronger the foundation, the longer it'll last. When we take care of our bones, we're not just preventing breaks and fractures, we're setting ourselves up for a better quality of life that ripples through pretty much everything we do. Let's start with the obvious stuff. Better bones mean you're less likely to end up in the hospital with a broken hip when you're older. But it goes way beyond that. When seniors feel confident about their bone strength, they stay active longer. They keep gardening, playing with grandkids, and doing all the things that make life fun. It's like a snowball effect. Staying active keeps your bones strong, which lets you stay even more active. The mental boost is huge too. Nobody wants to live in fear of breaking something every time they move. Knowing your bones are solid makes you more likely to join that dance class, travel to new places, or keep up with friends. Staying social and active is super important for keeping your brain sharp and your mood up, especially as you get older. Here's something most people don't think about. Stronger bones actually save everyone money. Hospitals spend a ton of resources treating broken bones and dealing with osteoporosis. If we can prevent these injuries, that means shorter hospital stays, fewer surgeries, and less need for long-term care. Those resources could go to other important medical needs instead. Speaking of money, better bone health means people can work longer if they want to. There is no need to retire early because your body can't handle the daily grind. This is especially important now that people are living longer and want to stay in the workforce. It's also a game changer for families. When grandparents stay healthy and independent, their kids don't have to put their lives on hold to become caregivers. Everyone gets to maintain their normal routine, which is better for both family relationships and bank accounts. The ripple effects go even further. As more people understand bone health, we might see changes in how we design buildings, parks, and cities. Schools might put more emphasis on building strong bones early. This means we might have more stairways instead of elevators, especially for not 1 to 3 story buildings. These give you the opportunity to exercise a little bit more every day. And here's the best part. All this knowledge gets passed down. Kids who grow up understanding bone health are likely to keep up good habits their whole lives. They'll pass these habits on to their kids, and gradually, we could see fewer people dealing with serious bone problems as they age. The community impact is pretty interesting too. As more people stay mobile into their later years, we might see more demand for walking-friendly neighborhoods and better public spaces. This could make our communities more livable for everyone, not just older folks. Taking care of our bones isn't just about preventing breaks. It's about building a foundation for a better, more active life that benefits everyone. From healthcare costs to family dynamics to community design, good bone health has a surprisingly big impact on how we live, work, and play. If you've enjoyed watching this video, hit that like button and subscribe for more expert health tips and life-changing advice.